A warm welcome to Ambassador of India to Kuwait, His Excellency Shri Sibi George, Madam Joyce Sibi, members of Indian Doctors Forum, Friends of India in Kuwait, Indian Diaspora, members of Indian associations, members who joined us live on social media platforms and media fraternity. On behalf of the Embassy of India Kuwait, I, Jasmine James, welcome you to the World Blood Donor Day celebrations. Observed every year on 14 June, World Blood Donor Day is an initiative by the World Health Organization. The aim of this day is to spread awareness about blood donation and the need for safe blood and blood products. Also, it is celebrated to appreciate the contribution of voluntary blood donors in saving lives. Embassy inaugurated celebrations of 75 years of independence of India on 31st March 2021. Today's event is one of many programs Embassy is organizing to celebrate at 75 and 60th anniversary of establishment of diplomatic relations between India and Kuwait. Today's event is organized to highlight contribution of Indian blood donor heroes in the state of Kuwait. We will honor such selfless Indians who have donated more than 5 times. We will also honor those associations who have organized blood donation camps in the year 2021 and 22 and have been a part of the noble cause of saving lives. We will also have 5 live quiz questions today. Correct answers will also be felicitated at the end of the program. Let us begin our program with National Anthem of India. Please welcome Kuwait Chamber Chorale on the stage. I request everyone present here to rise for the Indian National Anthem. Moving ahead with the program, may I now invite Ambassador of India to Kuwait, His Excellency Shri Sibi George, Madam Joyce Sibi, and Dr. Sajna Mohammed, Vice President of Indian Doctors Forum, to come to the dais for traditional lamp lighting ceremony. Welcome, sir. Welcome, ma'am. I request Madam Joy Sibi, Dr. Sajna Mohammed and Sir to take their respective seats and Ambassador Sir to deliver his remarks.
Vice President of Indian Doctors Forum, Dr. Sunil Yadav, Vice President Dr. Sajna Mohammed, our doctors who are in the panel for the symposium today, senior members of the Indian community, office bearers of various Indian associations, members of the media who are present here today, ladies and gentlemen, good evening and welcome to Embassy of India. Today is World Blood Donor Day. It's a very important day. Today we have assembled here to honor and felicitate our Indian blood donor heroes, our volunteers who have been donating blood regularly in Kuwait, and also our associations who have been organizing blood donation camps in Kuwait. I begin my remarks today by thanking His Highness Sheikh Nawaf Al-Ahmad Al-Jaber Al-Sabah, Amir of the State of Kuwait, and His Highness Sheikh Mishal Al-Ahmad Al-Jaber Al-Sabah, Crown Prince of the State of Kuwait, for hosting the large Indian community in Kuwait. Dear friends, the World Blood Donor Day is celebrated each year to raise global awareness of the need for safe blood and blood products for transfusion, highlight the critical contribution voluntary unpaid blood donors make to national health systems, support national blood transfusion services, blood donor organizations, and other non-governmental organizations in strengthening and expanding their voluntary blood donor programs by reinforcing national and local campaigns. According to World Health Organization, this year, the World Blood Donor Day slogan is, "Donating blood is an act of solidarity. Join the effort and save lives." To draw attention to the roles that voluntary blood donations play in saving lives and enhancing solidarity with communities. The specific objectives of this year's campaign are to thank blood donors in the world and create wider public awareness of the need for regular unpaid blood donation, highlight the need for committed year-round blood donation, to maintain adequate supplies and achieve universal and timely access to safe blood transfusion, recognize and promote the values of voluntary unpaid blood donation in enhancing community solidarity and social cohesion, raise awareness of the need for increased investment from governments to build a sustainable and resilient national blood system, and increase collection from voluntary non-remunerated blood donors. Dear friends, I am so happy to learn that Indians are the largest donors of blood in Kuwait. It's a great service. It's a great service extended by the Indian community, particularly the youth, to their host country. This is a fact stated and appreciated by Kuwaiti authorities and our Kuwaiti friends in various hospitals and blood banks in Kuwait. For us in the embassy, today is a day to remember and honor many of our Indian blood donor heroes. It is a day to thank our many associations and their office bearers who take the initiative in organizing many blood donor camps in Kuwait. It is also a day to thank our doctors and nurses who inspire our youth to donate blood and without whose support such blood donation camps would not have been possible. They are our unsung heroes whom we would like to honor and felicitate today. While we have endeavored to identify and contact most of the associations, groups, and volunteers, there may be so many volunteers who have not been able to reach out. It would be our endeavor to connect with them, all of them, and honor them at an event to be held in near future. Dear friends, today we are organizing two events to mark this important day. One, we have a symposium captioned The Science Behind Blood Donation by Indian Doctors Forum, IDF, where we have our doctors will tell us many things that we do not know about blood donation. To start with, on the benefits both for the donors and for the recipients. I congratulate and thank the Indian Doctors Forum, its leadership, and all its members, especially the panel of doctors who are here to conduct the symposium today. As you all know, IDF has always been amongst the most reliable partners of the embassy in our efforts to generate awareness within the community on topics of crucial relevance to each one of us. They have worked very closely with the embassy in many activities, be it organization of dedicated seminars, awareness campaigns, roundtable discussions to educate people about COVID-19 pandemic, or by conducting medical camps or free medical consultations. IDF doctors conduct free medical camp at the embassy shelter every fortnight. I recall the humanitarian service IDF as an organization and our doctors collectively and individually have given to the community during the pandemic, along with our nurses and other medical professionals. I welcome our doctors to this forum today. The second part of the event is to honor and appreciate our blood donor heroes. Like our doctors and nurses, our blood donor heroes also silently help save many lives without seeking any fame or glory. Let me repeat, for us in Kuwait, our Indian blood donors are our unsung heroes. I remember reading as a child, a blood donation truly is a gift of life that a healthy individual can give to others in their community who are sick or injured. Our blood can give a random stranger or a loved one another day in life. A feeling that you made a difference for somebody is probably one of the best feelings one can ever have. I also had the experience of donating blood during my youth, a memory that I cherish even today. I congratulate the Indian youth in Kuwait who come voluntarily forward and regularly donate blood. I am so happy to know about the various programs being organized by various associations and groups by organizing awareness programs for students and youth, setting up information booths and data collection, organizing blood donation drives, campaigns in various malls, campaigns at labor camps, cross-country roadshows, and online promotion using social media. Through their campaign in association with our doctors and medical professionals, they give the youth an opportunity to participate in blood donation drives. Their efforts to educate, motivate, and recruit new blood donors and mobilize youth as a new generation of voluntary blood donors should be appreciated and honored. Dear friends, the Indian community in Kuwait is blessed with the presence of various associations, particularly our youth groups, who work tirelessly to help those in need. They come forward sacrificing their time and energy for the common cause. Today, I reiterate that what I said on many occasions. For the embassy, each of the associations and our volunteers are our partners in our efforts to support the Indian community, in our efforts to ensure the welfare of the community, and in our efforts to transform the embassy as a home away from home for all Indians in Kuwait. I also thank Kuwait Chamber Choral for their and our young artists who would be performing for us today. They have always been part of the embassy in our celebrations. Before I conclude, let me invite you all to join me for the International Day of Yoga celebrations that we would be organizing on June 21st at 5 a.m. early morning at the embassy. Once again, I thank you all for joining us in today's celebrations. Thank you.
Thank you, sir. Let us have our first live question for the day. What is the lifespan of red blood cell? Anyone? Please raise your hand. Please raise your hand if you know the answer. Yeah, please. Sorry? Yes, correct answer. Sir, what's your name? I will now invite Kuwait Chamber Choral to present the patriotic song Vande Matram and the Song of Hope, Lead Kindly Light, with a candlelight vigil. Please welcome them. Thank you for such a wonderful performance. Let us have our second live question of today. What is the name of the iron containing protein that gives red blood vessels their color? Yes, correct answer. What's the name, sir? The theme of this year's World Blood Donor Day is Donating Blood is an act of solidarity. Join the effort and save lives. It is time for the symposium on the science behind blood donation by Indian Doctors Forum. I now welcome Dr. Sajna Mohammed, Vice President of IDF, to introduce the theme and panelists.
Assalamu alaikum, namaste and good evening. At the outset, I would like to extend a very warm welcome to His Excellency, Ambassador of India to Kuwait, Sri Sibi George, Madam Joyce Sibi, the Indian Embassy officials, and all those gathered here as well as on the virtual platform. On behalf of IDF, I would like to thank the Indian Embassy for organizing this very important and valuable symposium, The Science Behind Blood Donation, to commemorate the World Blood Donors Day. As Ambassador has already mentioned the importance of this day, I don't want to explain more about the significance, but I would just add one more point that this day is celebrated in honor of the birthday of Austrian biologist and physicist Karl Landsteiner, who is the father of modern transfusion medicine. They say, donation of blood means a few minutes to you, but a lifetime for somebody else. Very true indeed. Blood donation is one of the most altruistic deeds and acts of humanity, but quite a significant number of people fear blood transfusions due to either insufficient knowledge, diverse attitudes, or strange misconceptions when it comes to donating blood. Hence, to clear all this confusion and bring the facts before you, with extensive and sincere efforts, we have managed to stitch together an expert panel of doctors who are specialists in this field. It is a humble attempt to boost public awareness about the necessity for safe blood donation voluntarily and further dispel all the apprehensions associated with it. They will be explaining in a simple and coherent manner the actual process and facts about blood transfusion with the aim to motivate, inspire, and urge more people to donate blood. Dear panelists, kindly take your respective seats as I call out your names. I would like to invite moderator of the program, Dr. Lavi Agarwal, consultant histopathologist at Kuwait Cancer Center, working in Kuwait for the last 17 years, who graduated from Meerut University. She did her MD in pathology from Agra University and DNB from Delhi. Senior residency from University College of Medical Science and GTB Hospital, Delhi, which is a regional center for blood transfusion. Please have a seat, Dr. Lai. I take pride in introducing Dr. Sunny Joseph Varghese, consultant hematologist working in Adan Hospital since 2005. He graduated from AFMC Pune in 1984, completed MD pathology from Government Medical College Aurangabad in 1992, and PhD in hematology from AFMC Pune in 2000. He also worked in Indian Army from 1984 till 2005. Welcome to you, Doctor. Dr. Mohan Ram, another expert in this field, is a specialist in clinical hematology in KCCC since 2006. He graduated from GSVM Medical College, Kanpur, UP. He did his MD from SN Medical College, Agra, and fellowship in clinical hematology from Sanjay Gandhi Postgraduate Medical Institute of Sciences from Lucknow. Please have a seat. We also have amongst us Dr. Shamima Sharafuddin, cytopathologist in KCCC, previously Associate Professor at Ibn Sina Medical College in Jeddah and SRM Medical College, India. She has guided student research program for ICMR and has been actively involved in delivering health and cancer awareness talks to public in India as well as in Saudi Arabia and Kuwait. We welcome you, Dr. Shamim. Last but not the least, we have with us Dr. Satyanarayan Rajaganeshan. He is currently working as registrar in histopathology at KCCC. He graduated from Government Kilpauk Medical College, pursued MD and senior residency in oncopathology from Tata Memorial Cancer Center. He worked as histopathologist at Niroli Cancer Center, Surat. His fields of expertise includes histopathology, especially oncopathology, hematopathology, and molecular pathology. I welcome you all on board this symposium. And I would like to end by reiterating the slogan for 2021. Give blood and keep the world beating. Donate blood and save lives. Always remember, blood can circulate forever only if you keep donating it. Now I invite Dr. Lavi to take over the symposium. Thank you.
Dr. Sajna. Thank you, Dr. Sajna. So as we all know, today, 14th of June, is marked as the World Blood Donors Day. And as already Ambassador Sir mentioned, that this day was created to raise the awareness of safe blood transfusion and related blood products, and also to facilitate the unpaid voluntary donors. So why was this day created? WHO created this day, the motto of this day, that all the countries worldwide should have blood banks and supplies from voluntary unpaid donors only. So when it comes to blood donation, many questions, myths comes to our mind. So very shortly, we will be answering these questions with our team of panelists. But before that, I just want to highlight why is blood so important to us. So why it is so much important for our survival. So basically, very briefly, I'll tell you what is blood. Blood is a very complex thing, but very briefly, I'll explain. Blood is made up of cellular component and a fluid component. The cellular component has three things. One is the red blood cells. I think we just had a question that it has a pigment which is called hemoglobin, and the main function of that is that it carries oxygen. So we know that if there is no blood, there will be no oxygen, so all the body organs will die because of hypoxia. The second component is the WBC, which fights against bacterial and viral infections. And then the third component is the platelets. For example, any injury or something happens to our body, it prevents the bleeding, it stops the bleeding, the platelets. Then these cells are suspended in a fluid which circulates in our body, and also this fluid is called plasma, and this plasma also carries the essential nutrients and hormones from one part of the body to another. So I think I'm clear now that blood is very important for us. So without blood, we cannot survive. Now the importance of blood donation lies in the fact that till now, we don't have any substitute for human blood. We don't have any artificial substitute for human blood. So we are solely dependent on if any case of emergency arises, we are totally dependent from one human being to another for the supply of blood. So, and the donors, 1 hour and only 1 unit of blood can save 3 lives. With that, I'll begin my questionnaire. So the first question is for Dr. Shamima. So who can be a donor? Eligibility criteria for being a donor.
Thank you, Dr. Lavi. That was a nice question and very important question. All individuals, male or female, aged between 18 to 65 years are eligible to donate blood. Some countries even they permit 16 and 17-year-old teenagers to donate blood as long as they have fulfilled the other criteria, and they must have a parental consent or a guardian's consent. As long as the hemoglobin is concerned, for females, 12 grams is the minimum, and for males 13 grams is the minimum cutoff of hemoglobin levels. The body weight should be at least 50 kgs. And then if you look at the blood pressure and the pulse, they should all be within the normal range. Now questions that often come up among the donors, in a blood donation camp, whether I am diabetic, can I donate blood, I am hypertensive, I am taking medicines in 5 years, 10 years, is indeed you also can donate blood as long as your blood pressure and sugar levels are within the normal limits. And in specific for females, I would like to say that during menstruation, during pregnancy and breastfeeding, you're not supposed to donate blood. Yes, these are temporary reasons which can, and after you come back to normal, you can always come back and donate blood. I think that's it.
Thank you, Dr. Shamima. So that's really, you enumerated the eligibility for a donor. So the main thing we keep in mind is that we safeguard the safety of both the donors, howsoever the need of blood we have, but still we ensure the safety and we follow the criteria for the donors. Yeah, so now second question is for Dr. Sunny. So what are the deferral for the donor? Means some people, they do come forward for donation, still we reject some of the donors.
Thank you, Dr. Lavi. The deferral is meant to indicate that there is a temporary or a period during which donation is not accepted from the particular potential donor. It has a reason. This is basically to safeguard and protect the donor as well as the recipient of the blood which has been donated afterwards. So that we will see there be the reasons or the indications of deferral are derived from the questionnaire what we give to the donor before collecting the blood. That questionnaire contains quite a bit of questions. Questions are there pertaining to your travel history, pertaining to your medications being taken, pertaining to your high risk behavior, or plus what any procedures you have undergone, or any surgery, or any treatment, or vaccines, or immunizations, or if it is a lady patient, if she is menstruating, or if she is pregnant, or something of that sort. All these conditions have different periods of deferral. That means after the period is over, they can come back and join the donor team. And to elaborate on certain conditions, like the patient or the person is taking some tablets, say for example aspirin, he has to be deferred few days, while the person, if he is on a long-term medications, like for some elderly people, if it is on a prostate or rheumatoid arthritis, different conditions are there, or on blood thinners, then the period of deferral is going to vary, and it usually ranges from 2 days go up to mostly up to maximum 3 years, and very few occasions or very few conditions, like who is on antiretroviral therapy for HIV, they are permanently deferred. Otherwise, all the deferrals are temporary only for a short period of time. This is about the deferrals.
Thank you, Dr. Sunny. So as you mentioned, that basically we are doing the deferral to ensure the safety of both the recipients as well as the donor. So the recipients, because of certain diseases, they should not suffer from any chronic illnesses or lifelong diseases. So we take care about that. Okay. Then the third question goes for Dr. Shamima again. Okay. So what are the advices to be given before someone decides to give blood donation, so that a particular person comes to the blood bank, yes, and they follow those things, instructions, and then they come prepared?
Yes, that's a very important question as well. Before coming, if the person has intended to donate blood, he should start eating healthy food before and after donation of blood. His food should include iron-rich diet. The iron-rich diet, your dates and the green leafy vegetables, meat, fruit juices, and this not only before but also after the donation, so that his RBCs are restored quickly. Then sufficient amount of fluid before and after donation, so that he doesn't get dehydrated, falling dizzy and getting dehydrated, sweating, all that of types of reactions should not take place. And these fluids, what I am talking about, it should be alcohol free. Most important, alcohol should not be taken before 24 hours and 24 hours after donation, because the hydration process will become very slow. And he must sleep well, take about 7 to 9 hours of adequate rest. So because once he donates blood and he's restless, he hasn't slept, he's working. I know a few people in the donation blood bank I work, they were drivers, they're coming to give, and the whole night they'll be driving, and morning when they come straight away from duty, they come to donate blood, they fall dizzy, and all this entire process, people looking at them also get tensed, as so it was a very dangerous thing that they're doing. So you better have a good night's sleep and come. And most important, wear comfortable clothes, loose sleeves, so that you can roll it up, we can have to access the veins. And another thing that especially for first time donors, it's better you know what's going to happen there. So you are not taken up by surprises. See, the entire process just takes 1 hour. From entry into the blood bank until you finish everything and go, it's only 1 hour. So there's no need to fear. The blood bank personnel, the healthcare facility, all of them are very friendly. So you can always go up to them and ask and clear the doubts. If you yourself think you are unfit, it's better to take it on some other day. And then you have the bleeding process as such is only 10 minutes. So there's nothing to fear, and you can bring along a friend with you. A quick snack before having the blood donation is better so that your sugar levels are kept at normal. I think that's enough of advice.
Thanks, Dr. Shamima. And I feel these are really very simple advices, easy to follow. Yeah. So now the next question is for Dr. Satya. Yeah, the things which are important for steps in collection of blood.
Thank you, Dr. Levy. So, blood donation is totally a simple and safe procedure. So, whenever, yeah, it's on. Yeah. So, whenever you enter the donation center, you will be warmly greeted, and followed by that, you will be given a brochure. So, where all the procedure details will be there, and after that, you will be given a questionnaire. So, which you have to fill genuinely, which will be regarding your lifestyle and the medical history and what are the medications you are taking. So, that will be a short questionnaire will be given. Followed by that, you will be taken for a short counseling where your again the lifestyle and the histories will be inquired. Once these are done and you are fit, and you will be taken for a medical examination where you will be checked for hemoglobin, weight, blood pressure, and followed by that basic medical examination will be done. And again, if you are fit, you will be taken for the collection room. In collection room, you will be made to sit comfortable in a chair, and then your arm is clean, and sterile needle will be inserted, and this needle on another end it will be attached to the bag, which will have an anticoagulant. The main work of the anticoagulant is to prevent the clotting, and many of us has a doubt like how long the procedure will happen. Like the total procedure is like 10 minutes, and is it going to be a painful procedure? No, not at all painful. It is totally a complete painless. When there is a needle insertion, you will just feel a prick pain, that's it. So after that, there will not be any pain, and followed by that, how much blood will be taken. So totally the 450 ml will be collected, that we used to call it as 1 unit of blood. So once the process is completed, and you will be sterile dressing will be done, and the needle will be removed. And after that, you will be taken for observation room. For 15 minutes, you will be observed, and then refreshments will be given. So on that particular day, you can just do the light works, and you can refrain yourself from heavy and strenuous work. And from next day onwards, you can return to your normal work. So totally, this process is simple and safe and steady. And then I wanted to stress is like 99.9% there is no complication, and 0.1% there may be complication. That is due to the anxiety. And as Dr. Shamima said, like if you are well prepared for the donation, that can also be avoided. So everyone should volunteer for the blood donation. Yeah. Thank you.
Thank you, Dr. Satya. Steps look really very simple, and most of the donors sitting here might have followed the same procedures. Yeah. So now coming on to the next question for Dr. Sunny. What happens to the blood you donated? How is the processing and how is the storage of blood is done?
Once the blood is collected, first it goes for testing. That means part of the blood which has been taken from the donor, in a satellite bag we call it. It goes for basically grouping, and then it be tested for the transmissible or blood transmissible diseases like HIV, hepatitis, syphilis or malaria. And once it is proved negative, then only the collected blood goes for further processing. The 1 unit of blood collected from a particular individual will be processed into 3 parts. One is the packed cells or packed RBC we call it. It is basically used for patients or persons requiring hemoglobin assistance or hemoglobin increments, like in road traffic accidents. The second part is taken as plasma, which is used basically for patients requiring factor deficiencies or hemophilias or who's on overdose of anticoagulants or something of that sort. Then the third component is the platelets, which is usually, maybe you all are familiar with dengue, those who have low platelet coming up, and they are the ones in our parlance we are using most in that, or in other conditions requiring thrombocytopenia, or in cancer disease and something like that. Now, the three parts, now you can see that 1 unit of blood donated by one particular person is going to benefit at least 3 persons who are critically ill from your one donation. Like packed cells which have been collected is stored, and the additive solution we added, and it can be kept up to 35 to 42 days depending on the additive used. While the plasma, which is stored at minus 25 degrees centigrade, can be stored up to 1 year. While the platelets are stored at room temperature, that is 22 degrees centigrade, and it can be kept only up to 5 to 7 days. So here you can see the importance of the relevance of people needing to donate frequently, because this is a replenishable commodity which cannot be obtained or manufactured so far from any artificial means. So we need more donations to come through so that our stocks are adequately replenished and ready to serve the community. That's all.
Thank you, Dr. Sani. So these, like Dr. Sani mentioned, there's a particular shelf life of all the products of the blood. So it is our duty to replenish them frequently according to the time of survival in the shelf life, and hence the importance of frequent blood donation. Now the next question is, what about the blood grouping, typing and cross-matching? And Dr. Satya will enlighten us.
Thank you, Dr. Levy. So the blood grouping is essential. So everyone should know the blood grouping. So that is essential for the safe donation and to receive the blood and blood products. So basically there are the two systems which we are using. One is ABO system and RH system. The ABO system is discovered by Landsteiner, and based on the ABO system we have 4 groups, which is A, B, AB and O. How it is determined is, it is based on the presence of antigen which is present in the cell membrane of the red blood cells. So based on the RH typing, we have positive and negative. So based on this combinations, we have 8 major blood groups. Apart from this, we have many rare blood groups such as Bombay blood group and then Lewis and MNS. So these are the various blood groups are there. So what will happen, like if you transfuse one blood group to another one, so automatically if you do that, so all the red blood cells in the blood will get destroyed. So you have to transfuse the blood with the same compatible blood group. And to avoid this, like we have a cross matching where the donor and the recipient blood groups will be checked. Once it is compatible, then the transfusion process will be done. So the take-home message is we are having a various blood groups, and it varies from ethnic groups and places to places. So everyone should volunteer for the donation to have an adequate samples and in the each and every blood group. Thank you.
Thank you, Dr. Satya. So as you mentioned that because there are like multiple types of blood group, and to complicate the matter, we have also the RH typing and then the rarer blood groups. So we need wide variety of donors also to replenish or to meet the demand of the rarer blood groups or the variety of blood from various recipients. Yeah. Now, very important question is, who needs blood? Why do we actually need blood? Dr. Ram, please, may
Thank
I
you, Dr. Lavi.
request you to answer?
Yeah, as we heard about the process of the donation of blood, the question arises what we will do for this blood. There are variety of conditions where blood required. Like any major surgery, like heart surgery usually require 3 to 4 units of blood during the surgery. Other GIT surgery like Whipple surgery, any kind of major surgery will require blood transfusion. And apart from this, sometime, after childbirth, there is a complication called postpartum hemorrhage. That is very emergency conditions where blood required at least 3 to 4 unit, sometimes 6 unit. So apart from these surgical issues, there are certain diseases like thalassemia. Thalassemia is a genetic problem. It is two types, thalassemia major and thalassemia minor. Major is a disastrous condition, especially in children. They suffer a lot with low hemoglobin and they require a lot of blood, around 6 to 8 units in a month until the patient will go for definitive treatment like bone marrow transplant. These kind of children really suffer. Sometimes they cries for blood, but there is a shortage of blood. So we would like to request you all to donate blood to have plenty of blood. Apart from this, there is aplastic anemia. Aplastic anemia is the condition where bone marrow stops functioning. And if bone marrow stops function, there is a deficiency of blood. It will not produce by the main source, that is bone marrow. In this situation also, there are a lot of blood required for the patient. And patient dependent on the blood, unless patient will go for some definitive treatment. And definitely during that time, patient will have transfusion 8 to 10 packed RBC in a month. Apart from this kind of patient will require platelet also. So the platelet also come from the blood only. So sometime in tropical countries, there are certain conditions like dengue fever, where only platelet requires. If you have heard, you must have heard, sometime there is a crisis of platelet. Patient dies because of bleeding, because there is no platelet available. So where it comes from? It comes from we are coming and going to the central blood bank, or where is the center, we are donating and there is a platelet, make them available. So this is very important. Blood is life, as our panelist said, is a very good gesture to donate and give the life to the patient. Lastly, there is a condition, everybody knows, cancer. I am working in the cancer center, especially blood cancer. Blood cancer, there is a huge requirement of the blood. As per our center data, around 60 units of platelet and 25 to 30 units of blood required in a day. In one center, in my center only. Think about the other center, like 4 or 5 regional hospitals. There are many large major surgeries going on. They all require blood. Like a patient sometimes cries for platelet. Yesterday I had a call from my colleague, one patient having only one platelet. One platelet, how patient will survive? And there is a crisis in the blood bank. We had a call from Central Blood Bank, no, you have to promote the relative and friends, go and donate platelet, otherwise we are unable to provide. So it's humble request to you all to encourage people, friends, relative, and donate the blood to save the life of that kind of person. Like blood. Blood in blood cancer, it is an integral part of the treatment. Without blood, platelet, plasma, as our panelist said, we cannot start the treatment of blood cancer. Like one blood cancer patient, the treatment journey is around 3 to 4 months. During that period, this patient will require around 70 units of platelet, 30 units of blood. From where it will come? It has to come from us. The blood is not being prepared by artificially. So it has to come from us only. So it's again we are requesting you all to come forward and donate blood and save the life. Thank you so much.
you, Dr. Ram. You have very well explained the conditions we need blood, which we experience as doctors in our day-to-day practice. But we should really not forget about some of the conditions which can happen suddenly, like earthquakes, natural calamities, landslides, where suddenly we need lots of blood. So our blood bank should be prepared for those. Because normally our blood banks are supposed to be prepared for these day-to-day surgeries and thalassemias and such like stuff. But we should not forget about these calamities as well. And Dr. Ram, also one more question for you, that how do you feel like, because this demand looks like huge for us. So in your clinic, in your experience in Kuwait for so many years, how did you cope up with this much of demand? Did you face any crisis or for this much of demand of blood?
Thank you, Dr. Lavi, to raise this question. This is very important to all of us. You know, we have to salute our Central Blood Bank. Central Blood Bank is doing a tremendous job. Apart from this, our volunteers, our associations, they are really doing wonderful job. But the process, the association going the Central Blood Bank, they will be received and they will be welcomed and they will give the blood. But still, sometimes we face difficulties and issues regarding the procuring of the platelet and blood. During that time, we really have a jitteriness how to manage the situation. During that time only we encourage families, not encourage only, we insist the family to go and donate blood and platelet because this is going to be a crisis. Especially during the holy month of Ramadan or long vacation where many people will travel. Especially that point of time, really we face a difficulty. Likewise, nowadays vacation started. We are facing difficulty. So, despite our request to the family and relatives, I would like to request you all to encourage your friends, families, brother and sister who is eligible, who can donate and save the life, come forward and go to the Central Blood Bank. There are three central places where we can go according to their convenience and donate the blood and platelet. So, really, sometimes it is challenging, like I mentioned before, there is one patient, very young patient, ongoing treatment for cancer, blood cancer. She is suffering for the platelet. Platelet was one. It was very difficult to manage. So, fortunately, we have a very good and well-equipped Central Blood Bank. And they have contacts and they will immediately contact our association. Really, I salute them. They are going and donating this blood and saving the life. And it's a really appreciable job. Thank you so much.
Thank you, Dr. Ram. So now the next question again for Dr. Ram about the transfusion reactions.
Sorry. Transfusion, as we have heard, a lot of process has been done or is being done before the transfusion, before giving blood to the patient who require the blood. We should know, we should have a clear, it's not an easy job. It is a very complex process. But it is being done in a smooth way in the central, well-equipped center. Still, we have to take the precaution. We have taken the precaution while the collection, storing, grouping, cross-matching. Apart from this, if we will request the blood will come. It will be counter-checked by the doctor who is on call. Regarding the blood group, cross-matching, time of collection, and expiry date. Sometimes the blood unit also they will check. Apart from this, patient, before giving to the patient, our staff nurse, they are doing a tremendous job. I really salute them. They will verify again the name of the patient, blood group and everything they will transfer. Even that, sometimes we face side effect or reactions. That reaction may be minor to the serious also. Minor reaction like some allergic conditions, patient may feel flush, hotness, rashes over the face, or abdomen, sometime breathing difficulty, sometime they will have a fever that may be the non-hemorrhagic or hemorrhagic too, and anaphylaxis. Anaphylaxis is very serious condition. That anaphylaxis usually happens because of mismatch. If blood is not properly matched or cross-matched, it may happen. It can be the life-threatening also. Apart from this anaphylaxis, there is hemolysis. Hemolysis is another condition where it can be risk to the life. This kind of reactions we are preventing and doing by cross-matching and things, and we are preventing not to happen, but still we face this kind of reaction with the patient. And sometimes a patient elderly or something with multiple comorbidities, other diseases, he may have overload. That is also very serious condition. We have to be careful during the transfusion, especially in elderly. Sometimes if you start the blood, patient may start breathing difficulty, severe breathing difficulty, may have frothy blood from the mouth. It is also very serious condition. That is called transfusion related acute lung injury. Apart from minor allergic reactions, there are very minimal serious side effect or transfusion related reaction that is being managed properly in the hospital. Most of the, like 99.9%, but still there are certain issues can be very serious and threat to life. Because of this proper cross-matching blood grouping, we are not getting that much reaction in the hospital. It is very rare, 1 in 2 million cases. It's very rare because of this processing what has been discussed with our panelists. If it is in hurry, definitely there will be disaster. That disaster to manage very difficult. It's very, very difficult. So sometimes it happens, but it is mostly manageable in the hospital. That's why it is advisable. Any blood transfusion that has to be given in well-equipped hospital with experienced person in supervision of physician and staff nurse. Thank you.
Thank you. So actually this transfusion, like Dr. Ram already mentioned, it's always done in a hospital setting, and if at all some complications or some adverse effect happen, it can be very well managed with our team of doctors. And also on one hand we have this blood transfusion as a life-saving procedure, and on the other hand we have this adverse reactions which are really minimal. So I think still we will proceed for the blood transfusion, which is really a life-saving procedure. Yeah. With that, we'll move on to the next question, and which is very relevant for today. And what are the benefits of being a donor? And it goes for Dr. Shamima.
Thank you, Dr. Lavi. That's again a very, very important question, especially on this Blood Donors Day. The benefits of blood donation are far, far beyond those little inconveniences that you face during the bleeding process. The donation process is nothing compared to the benefits. As you all know that blood donation is always voluntary. As much as we encourage all of you to come forward to donate blood, there can be no compulsion. It should be voluntary. It's purely an act of altruism, an act of benevolence that you can give to your fellow human beings. Secondly, during the blood transfusion services, the blood transfusion service, they have a duty of care for not only the recipient but also the donor. Just before donation, we have a brief counseling, a medical checkup, and during this medical checkup, something new comes up. Some people, they don't know, they don't have blood pressure, they do not know, they have some rare blood groups, they have some bleeding disorders, some very abnormal blood disorders. So all this are picked up during at a very early stage. Normally people, I don't think how many people go for a regular medical checkup. So just like that, now these medical problems are picked up, and they are further referred for higher specialist management. So that is another important advantage for coming for a blood donation. Out of 100 people, if 100 people are going to come to the blood bank volunteering, only less than half of them only are going to be eligible. Now these are real statistics. only 50%, or actually it's only 38% of those who volunteer to come to donate blood, only less than 40 are actually eligible to donate blood. Third important thing is that there are people who have increased iron storage in their body, as doctor was saying, like hemochromatosis and high RBC count. For them, donating blood is an important part of the treatment. If they do not donate blood, then it's the end. So there will be a heavy overload of iron in the important organs like pancreas, like in the liver. In order to balance the iron storage, for them it becomes very crucial to donate blood. And many studies have shown that those people who frequently donate blood, now who are frequent donors? Frequent donors are those for men, like they get at least three transfusions, 3 donations per year. Now these people are known as frequent donors. Or regular donors as such, when they start donating blood, the risk for heart attacks, for the risk for strokes is reduced by 88%. By giving blood, the blockages in the blood vessels are released, blood begins to flow freely, and so these type of infarctions, strokes and heart attacks, these are reduced. Another and very, very important thing, that it is a great virtue. Once you have donated blood, as our Highness was saying, in his childhood he still remembers, in his youth he still remembers till today that he has donated blood. Actually, I have gone many times and I was deferred because of the hemoglobin being on the borderline. It was only last 6 months back I donated blood and I still feel great about it. So by donating blood, you have an emotional well-being, it promotes your mental health, and it beats depression. And in all religions and cultures, it's an important act of charity, an important virtue that you're giving to your fellow human beings. I think these points, these benefits are enough for all of you to donate blood. No, there is no need to hesitate. So thank you, Doctor.
Thank you, Dr. Shamima. Really, the benefits are huge. And besides, our donors are really our superheroes, as our ambassadors are also mentioned. And plus, we get the bonus of so many benefits, both physically and mentally. So let's join our hands and donate blood liberally. And now the floor is open for questions from the audience. Yes, sir.
From Kuwait television. My question is for Dr. Shami. You said that the eligible blood donor should not exceed 65 years of age and should not suffer from high blood pressure. Why? What's wrong with this blood?
Say they should not suffer. I said even if they are hypertensive patients, it could be, they can give blood as long as it is under control. Yeah.
He is eligible.
Yes, sure. Diabetics and hypertensives.
In addition to his, so age is no barrier.
Yeah.
Anybody who is healthy, he can donate the blood, he can donate the blood.
Sure.
Any other question from the audience? Yes, sir. No, all you can individually go. Even there is a central blood bank Kuwait, as well as there are like 2 regionals.
Sometimes back when we approach the blood bank center, we got information that only a group of the people can approach the blood bank center, not individual.
Dr. Sani has something to say.
Yeah. See, as an individual, you are always welcome to the blood bank. Now the central blood bank is there. There are 2 regional blood banks. One in Ahmadi region, which is near to Adan Hospital. Other one is near the Jahara region. And they encourage group donation. What they say is, if you have a group of people, they will come to your location and collect blood. That also they are ready. There is no bar that it has to be in group. Individual also they are welcome.
Yes, sir.
There is a restriction sometimes.
If we are traveling to India within 6 months.
No, not traveling. If you come back from India, that's why I said we have the travel history. If it is any malaria endemic country, 6 months has to lapse after he returns for donation in Kuwait.
So difficult for us.
Sometimes
That depends if you are a frequent traveler. That's the problem.
And then travel.
Yes.
Why there is 3 months gap between first and the second donation?
Dr. Shamima will answer.
We had a question and the answer also was there for how much time it takes to replenish the RBCs is 3 months. So that's why this gap. For females, because of the menstrual cycle, it's still later. That's for females, we give a gap of 4 months until the next transfusion, next donation.
Thank you. Yes.
Once they got the symptom of malaria, then when we are collect the blood, that time they are identify the symptoms of malaria. How long they can last ma'am in blood bank?
So your question is for malaria, how long? There's a deferral period.
That is 6 months. 6.
But they are almost 3 years they are black. Still they didn't open.
Malaria?
For malaria symptoms.
Maybe some other reason attached to
There
that.
are symptoms.
For malaria per se, it is 6 months. And if that is the concept of something called a chronic malaria, some of the species have we have something called as chronic malaria. They are the ones 6 months. Otherwise, no, not more than that. Usually not, unless you have some other associations.
So, okay. Thank you.
My question is, doctor was mentioning a benefit of early detection.
Early detection of what?
Early detection of some
Yes, yes.
mental disease in rats.
Yes.
So, do we have a system in place to track this back to the donor?
Yes, indeed. Because once you donate the blood and go home, they are checked for infectious diseases. Every country has its own standard tests what they do. It cannot everything under the sky, but at least the most common transfusion transmissible diseases are tested for, like malaria, HIV, hepatitis B, hepatitis C, and what else, doctor?
Syphilis.
Syphilis. So once they are tested positive, in case they are tested positive, it is the duty of the blood transfusion system to call the donor and inform them very confidentially that it is positive and please see this doctor, this doctor. And even during the testing, I mean this testing is done after the donor leaves the center. And even during checking up also, if there are sometimes abnormal heart rates, abnormal blood pressure, some other new skin lesions, some ulcers in the mouth, all these things also the doctor there will take care of and refer to the required specialist, whoever is necessary. So I mean these are the perks of coming to the blood bank.
Some of the persons are regularly dropped in the system. When we have to approach them, they will not disclose. How can we know what is the reason?
Once the screening is done or the transmissible diseases have been screened, if it is anything is positive, it goes to the confirmation to the virology center. And if it is and the risk group of the Kuwait disease registry, the public health will contact the person concerned. And the blood is discarded anyway. But your question of going back and permanently deferment is only done for somebody who is on antiretroviral treatment, that is HIV treatment, not otherwise.
But they will not disclose it.
No, they will not disclose it.
How can we know?
It's better that you are not called back.
Regularly happen, that's why.
Okay. The platelet donation. Platelet donation, yeah, Dr. Sani.
Yeah, I mean platelet, it can be donated every 2 weeks also. If it is a apheresis plate, we didn't go into the details of the collection. There are single donor collections, multiple donors, and apheresis collection. There are different types of collection. Those who like in blood cancer patients who require more platelets, we prefer apheresis collection, which can be done every 2 weeks, and maximum about 15 collections can be done per year on a particular individual.
Now we have only one more question. This is the last because we are running short of time. Yeah, please go ahead.
During the first or second question, you were mentioning like donor should take adequate rest, otherwise it will be sleep or good food and rest, otherwise it will be risky for them.
Yes.
Know what is the kind of risk involved in that, because I am a frequent donor. I have donated more than 42 times. But the question is, like many of the times in my early days, we used to give blood and maybe we'll go to play, or maybe sometimes in between the tournament or something. So the sleep and rest will be very less. So will it have a long-term effect or any problem in the long term because of the lack of rest or something?
I asked to sleep and come. I didn't tell you to donate and go and sleep. You must better sleep, take good rest and come to donate. And because if you come restlessly, then you have, there are a lot of patients fall dizzy and fainting, and then it affects the other donors. So I'm reiterating that you take rest and then come to donate. Once you donated, you can do your normal work, maybe, but not heavy work, not for tournaments and all. I won't suggest.
So what is the risk involved in that? That's what I asked.
No, it's just a temporary inconveniences. There's no risk. Only inconveniences.
Some donors feel fainting, sort of thing. That's why we said for a short period of time they should take rest. Otherwise, no long-term harm. No.
So here as doctors, we have tried to cover the science behind the blood donation. However, the humanity, the solidarity, and the joy of giving a new life, all of us can experience by a simple act of kindness through blood donation. And with that, I'll just say the slogan of year 2022, I think, which is already repeated many times, but I'll still not get tired of repeating it. Donating blood is an act of solidarity. Join the efforts, save life. Thank you.
Thank you, Dr. Mohan Ram, Dr. Lovi Agarwal, Dr. Sunny Varghese, Dr. Shamima Sharfuddin, and Dr. Satyanarayan Rajaganeshan for this wonderful session imparting knowledge on the science behind the blood donation. I will now invite His Excellency Ambassador C.B. George, Dr. Sajna Mohammed, and Dr. Sunil Yadav on the stage.
Thank you, sir.
Thank you so much. Thank you.
I will now request Ambassador to honor the IDF members with the Azadi Ka Amrit Mahotsav memento for their selfless service and upholding the Indian value of Seva Parmo Dhamma in Kuwait.
Thank you. Thank you, sir.
Thank you. I will now request Ambassador Sir and panelists to take their seats. Let us have the third live question of today. Which is body's largest blood vessel? The last guy with the green shirt. No. Please raise your hand and give me the answer. So, your good name? Congratulations, Mr. Manish. You are correct. The correct answer is Oata. Let us now see a video by National Blood Transfusion Council of the Government of India on voluntary blood donation. रक्तदान करके देखो अच्छा लगता है.
Blood is a vital component of human life, as it provides crucial nourishment to body tissues and organs to sustain life. Providing safe and adequate blood and blood products is an integral part of country's national blood policy. To strengthen the government's initiative, it's our responsibility to contribute for voluntary blood donation. Do you really care? Did you think about it? %96 of us rely on the other 4% to maintain blood supplies. Every 3 seconds, someone needs blood. A unit of blood can save more than one life. Any healthy person having 12.5 grams of hemoglobin and 45 kilograms of body weight from age 18 to 65 years can donate blood. An average adult has 5 liters of blood in the body and can easily afford to donate 350 to 450 milliliters during one donation. Donation can be made every 90 days. Blood donation is a safe medical process. You will not be infected with any disease by donating blood. There's no need to be afraid of. Blood can be donated at any nearest licensed blood bank or voluntary blood donation camp. Donating blood voluntarily is the greatest gift one can offer to humanity. Do you really care? रक्तदान करके देखो अच्छा लगता है.
Now, the fourth live question for today is, what is the normal blood pressure of a healthy person? Please raise your hand if you know the answer. Raise your hand. The yellow t-shirt. Yes, congratulations, you are correct. It's 120/80. Your good name, sir? We will now move to the next segment of our program. I will now invite His Excellency Ambassador C.B. George and Shri K.S. Rathore, First Secretary, Community Affairs and Associations to the stage to felicitate India's blood donor heroes. I will now call the names of the voluntary blood donors and request them to come to the stage from my right side and get down from the left side. Mr. Abdul Munir, Mr. Anil Kumar Anandan, Mr. Arun Satyan, Mr. Baiju Thomas, Mr. Balamurli KP, Miss Beena Murugan, Miss Bensi K. Baby, Mr. Bharbur Singh, Mr. Biswaranjan Sahu, Mr. Deepu Chandran, Miss Dhanya Radhakrishnan, Mr. Dheeraj Kumar, Dr. David Bhagitta Rajan, Dr. Sumant Mishra, Dr. Vasudevan Jagannathan, Gurvinder Singh, Mr. Harjinder Singh, Mr. Inderjit Singh, Mr. Jasbir Singh, Mr. Jayakrishnan Gopalan, Mr. Jayan Sadasivan, Mr. Jijo Joseph, Miss Jisha Jayakumar, Mr. Joby Baby, Junaid Cholail, Mr. Khalil Ahmad Abdul Bari, Mr. Kangaraj Sivakumar, Mr. Lijo Philip, Mr. Mohammad Sharif, Mr. Mohammad Nasir Bolar, Mr. Nalinkakshan Tayat Valambil, Mr. Nibi Cherian, Nimish Apachan Kavalam, Mr. Prashant C., Mr. Praveen Kumar, Mr. Prem Kiran, Mr. Rajesh R.J., Mr. Ramesh Pujari, Mr. Reggie Achankuny, Mr. Ruhail VP, Mr. Saju Thomas Stephen, Mr. Salah Abu Bakar, Mr. Sanat Kumar, Mr. Satnam Singh, Mr. Sattupilli Srinivasa Rao, Mr. Satyanarayan Pantil, Mr. Shafi Shahjahan, Ms. Shalini Surendra Mohan, Mr. Shyam Raj, Mr. Simjo Chungatil Varghese, Mr. Sukhvinder Singh, Mr. Surendra Mohan, Mr. Suresh Neramballi, Mr. Surendra Pal Singh, Mr. Tajuddin Mohammad Siddiq, Mr. Thomas P. Samuel, Mr. Venugopal Rajan Nair, Mr. Vinod Kumar Nittu Komat, Mr. Vishu Kumar Pujari, Thank you, sir. I will now call the names of the association and request the association members to come to the stage for felicitation of their association. Adoor NRI Forum Kuwait. Alappuzha Jilla Pravasi Association. Bharatiya Pravasi Parishad Kuwait. Billava Sangha Kuwait. Blood Donors Kerala. Indian Pharmacists Forum. Kasargod Expatriates Association. KKB Sports Club Kuwait. KMRM Abbasiya Area MCYM. Kollam Jilla Pravasi Samajam Kuwait. Kozhikode District Association Mahila Vedi. Kuwait Kerala Muslim Association. Kuwait Gnanai Cultural Association, Kuwait. Kuwait Malayali Forum. Kuwait Tamil Islamic Committee. Lifesavers Global. Malayali Moms, Middle East. Marthoma Yuvajana Sakhyam. Music Beats. Non-Resident Tamil Indians Association, Kuwait. OICC Kasargod DC. Rajasthani Darpan Association, Kuwait. Santwanam, Kuwait. Sardi, Kuwait. Shahid Bhagat Singh Youth Club, Kuwait. Sri Satya Sai Service Organization, Syro Malabar Christian Association, Tanima Kuwait, Trask, Trishur Association of Kuwait, Tulukuta Kuwait Organization, UPNRI Forum, Vismaya International Arts and Social Services, Youth India Kuwait, Thank you, sir. I now request His Excellency to take his seat and request Shri K.S. Rathore, First Secretary, Community Affairs and Associations, to deliver the vote of thanks.
Very good evening to each one of you present here and to those connected with us virtually in this event. On behalf of the Embassy of India in Kuwait, I feel honored and privileged to deliver the vote of thanks. At the outset, I would like to congratulate all the associations that organize blood donation camps during the year 2021-22. As the officer responsible for Indian associations in Kuwait, I was able to attend some of these camps. I congratulate all such associations and individuals felicitated today on the World Donor Day for their inspiring community service. In fact, today's event is a great source of encouragement to the Indian community at large in Kuwait. This is also a testimony of Indian Embassy's deep commitment to acknowledge the good work of our community volunteers and associations. I also take this opportunity to thank Indian Doctors Forum and particularly the office bearers of IDF for extending continuous support aimed at promoting awareness about various aspects of human health. I do appreciate the words of all the panelists here who enlightened us about various nuances of blood donations and tried to alleviate the fears prevailing among the many of us. We also sincerely thank our friends from media, KCC, for their participation in today's program. Finally, I would like to express our deep gratitude to the Ambassador of India to Kuwait, His Excellency Sri CB George and Madam Joy Sibi, for their continuous guidance and support in organizing this felicitation event. Ladies and gentlemen, once again, I thank you all for being with us this evening. Jai Hind.
Thank you, sir. We have now come to the final segment of our program and also to the final live question of today. So, what does WBC stands for? I don't want to hear any answer. Just raise your hand. The guy in a pink shirt. Come again? Yeah, congratulations, you are correct. It's white blood cell. Let us finish this program with style. Please welcome the cultural team of Blood Donors Kerala.
चांद की चिड़िया गहलों के लात मेरे साथ आओ ना आओ। മുന്തിരി വാട്ടിയ രാവ് സ്നേഹരതിയുടെ രാസനിലാവ് ഹൃദയരാഗം ചിറകിൽ വിരിയും മധുര വീഞ്ഞു ശലഭം വരവായി അടടപ്പയ്യ അഴകിതയ്യ ഉടലിതൊന്നായി ഒഴുകാനൊരു കുറിവാ തൊട്ട് തൊട്ട് നിന്ന് മുട്ടി മുട്ടി വന്ന് മുത്തം മുത്തമിട്ടതാകാനേ കണ്ണു കണ്ണെറിഞ്ഞ് കാത്തു കാട്ടത്തനി കട്ടെടുത്തു அருகில் நீயும் வந்தால் என் உறக்கம் கேட்கிறாய், எதிரில் நீயும் வந்தால் என் உயிரை கேட்கிறாய். அடி உன்முகம் கண்டால் என் இவை ரெண்டும் கைகள் தட்டுதே. அடடா 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 என்னை ஏதோ செய்கிறாய், அடடா 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 என் நெஞ்சை கொய்கிறாய். உனது உருவம் போல வடிவம் காட்ட கண்கள் மறந்துதடி. பூவில் ஆடும் பட்டாம்பூச்சி கூட நீயும் நடந்து கொண்டே பறந்து செல்லும் அழகை ரசிக்குதடி. உன் செய்கை ஒவ்வொன்றும் என் காதல் அர்த்தங்கள், நாள்தோறும் நான் சேர்க்கும் ஞாபக சின்னங்கள். அடடா 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 ஏதோ செய்கிறாய், அடடா 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 என் நெஞ்சை கொய்கிறாய். उससे जहाँ से मिटा मुकाला मुकाबला लैला ओ लैला मुकाबला सुभान अल्लाह लैला ओ लैला పొలం గట్టు దుమ్ములోన పోట్ల గిట్ట దూకినట్టు పొలేరమ్మ జాతరలో పోతరాజు ఊగినట్టు కిర్రు చెప్పులేసుకొని కర్ర సాము చేసినట్టు మర్రి చుట్టూ నీడలోన కుర్ర గుంపు కూడినట్టు ఎర్ర జొన్న రొట్టెలోన మిరప తొక్కు కలిపినట్టు నా పాట చూడు నా పాట చూడు నా పాట చూడు నాటు 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 వీర నాటు 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 ఊర నాటు 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 పచ్చి మిరపలాగా పిచ్చ నాటు 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 పిచ్చు కత్తిలాగా వెర్రి నాటు.
ഒളിച്ചടുത്തെ ട്രാക്ക് മാറ്റി.
Thank you, Blood Donors Kerala, for promoting the message of blood donation in a fun-filled way. For this perfect performance, let's give them a huge round of applause. I now invite His Excellency Ambassador C.B. George and Madam Joyce C.B. to the stage to have a photograph with these lovely and talented kids. I will now request the artists to have their seats and will now call the names of 5 live quiz winners for their felicitation. Mr. Faisal. Mr. Faisal. Mr. Joby. Mr. Manish. Mr. Murtaza. Mr. Jignesh. Thank you, sir. With this, we wrap our program today. Thanks and Jai Hind.